side as well. And thank you very much for joining me and having this lovely conversation. And I think it's quite a very key, interesting conversation. Not something that I normally do. I touch based on a whole lot of marketing and all of that. This is the space that I'm not familiar with. That's why I called in an expert. And maybe before I begin the conversation, I just want, let's break down who is Ayanda Kunene. Is your surname still Kunene, by the way?
Yes, it is.
Okay, sorry. Cool.
Yeah. So Ayanda Kunene is a 34-year-old healthcare professional. I am a pharmacist by profession, and I've been in the profession for like almost 10 years now. And I've practiced in public sector, the private healthcare sector, and in the NGO space. I am currently in the UK doing my master's in global health policy with a focus. My research interests are in strengthening health systems and the NHI, and how we can provide quality healthcare to South African people who are underprivileged and can't basically afford healthcare.
What is NHI? Is it what is National Health Insurance?
Yeah, it's National Health Insurance. Yeah.
No, that's a topic for another day, but I'll ask your views about it some other time. So let's just right straight to it. Plant-based nutrition. What is that? What does that mean? Simple layman terms.
So plant-based nutrition, in layman terms, is using plant-based resources to incorporating plant-based resources into food, basically. Not using like animal derived nutrients.
A lot of education around it, or there's a lot of misconception. What misconception do you think they are around plant-based nutrition?
It's associated with like a niche market, like it's for rich people. And it's for people who can afford to go to, I mean, in the South African context, it's for like Woolies type people. But I think that is a misconception, because what we don't realize is a lot of our diets already include plant-based, like vegetables, fruits, legumes, that kind of thing. We already in our African diets have stuff that is healthy, is nutritious. When you think plant-based, you shouldn't just think like high-end, expensive type thing. We can incorporate that with food that we're already consuming back at home. It doesn't necessarily have to be something, extravagant. So yeah.
Okay. I think, let me tell you, in medicine world, I think if I speak to my grandmother tells me there was literally zero of a pill that they used to take, and they used to live longer because they were eating vegetables only, and they would take from the trees some what and whatever. And when you read some of the medication that we take, and you go through all of it, sometimes you find ingredients that include leaves, aloe, and blah blahs, and all of those things, and you can see it's the nutrition. So how do you think we can incorporate, or maybe integrate plant-based nutrition versus the medical science, your pills and all of those things, and also looking at South Africa, the culture that we have,
I think one, it would be to use people who have influence in society. I think we have a lot of like influence culture. So when people see people that they look up to doing certain things, automatically they want to be associated with that. So if we use the resources that we have in people who are respected in communities to say, actually, this is what we're trying to achieve. This is what you're trying to educate the community on. And if they see influential people doing that, then that's another way that we could use to educate communities. And also like doing research. I think a lot of research needs to go into understanding the perceptions and the cultures in the people that we're targeting. So if you understand what their beliefs are, then it's easy for us to, sort of, I don't want to use the word challenge, but to address the conceptions, which aren't always misconceptions, but I think more research needs to go into what are the barriers to people understanding the importance of like healthy living and healthy food consumption, and how can we integrate that into their beliefs, into their culture. How do we use science and make it relevant, but how do we get people from those communities to teach people from those communities? Because it's different if you get someone who's from outside who's not really aware of the cultural norms.
Yes.
So I think that's one.
So
That's
we're
one
kind of
way.
making it cool.
Yes, yes.
We're kind of making it cool. I
Yes.
get you. I get you. Yeah. Okay,
Yeah.
cool. Is there any research that is proven that's out there that speaks about how plant-based nutrition can help with particularly things like diabetes?
Yeah. Well, so with things like diabetes, a lot of um, research is centered around diet,
Yes.
because a lot of the reason why we have such like a high burden of so diabetes and like similar diseases are called like non-communicable diseases, because of lifestyle, which includes like diet, which includes people not being active enough, and which includes like people not consuming diets that are diverse. So you find that people are eating the same stuff that's not very healthy, and also the availability of fast food. Like we have a very high fast food culture. Like at every corner you find like a fast food restaurant, and people are using cars now. People aren't walking distances, and there's a lot of drinking culture as well.
Yeah. And
Um,
Uber Eats.
and Uber Eats, that sort of thing. So people aren't cooking as much.
Yeah.
Uh, so diet is a huge thing. It's a huge factor when it comes to conditions like diabetes, and addressing that would be, it would be quite important in managing and educating patients on how they can, like manage their diabetes.
Yeah.
And yeah.
And if 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 we had structured things in the ideal world, imaginary world, Disney
Mm,
world, where everyone is just eating healthy, eating right, no fast food.
yeah.
Well, because I was listening to this podcast about like how this guy is 45, but he says he's 16 according to science, according to him. I don't know what he's eating and doing all of those things. I'll
Yeah.
share that
Yeah.
podcast with you. But is there such a thing? Is it realistic? What are the benefits of eating healthy? What are the benefits of plant-based nutrition? Are we talking that I'm gonna be 200? Are we gonna see people living up to 200?
Yeah, so I think the benefits of plant-based nutrition is, and like you say, like it's an extended life expectancy. So when people are eating healthy, they become healthier, they live longer, and they contribute to the economy. Because when people aren't sick, they're going to work and they're contributing to the economy. So those are some of the benefits.
Yeah.
And also just general well-being.
Mm.
When you have people who are healthier, they're happier, and we have less societal problems, if I can make it as broad like that.
Yeah.
So eating healthy has got like lots of, and people don't become as sick as often. So
Mm.
you won't find a lot of people having to go to the hospital to access
So who's gonna
healthcare.
study medicine then?
Yeah, and that means the pharmaceutical industry. It means I don't have a job.
Yeah.
But ideally, it just
Yeah.
means that people aren't getting sick as often as they are. It means people live longer, healthier lives.
Yeah.
It's just like a lot of physical, mental well-being as well, because I mean, you can't separate the physical from mental well-being.
Yeah.
So yeah, I think those are some of the benefits.
Can confirm it where
Okay.
some franchise, I won't mention names, they get a tomato, they inject it, that tomato, it's 5 tomatoes, they're big, they take a chicken, the chicken was a chick. Next week, the chicken is big. Next thing,
Yes.
we are frying it and we are eating it and we are consuming all of those things, those injections and
Yeah.
blah, 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 right?
Yeah. Um,
What's your general thoughts around that? Is that,
it's
firstly, is that true? Is that what's happening?
I'm not trying to get sued, but
That's why I'm not mentioning any brand's
but
name. I'm not mentioning it, but I'm just
I mean,
saying that
studies, I
is
think
there.
studies have suggested that, I mean, there's a lot of chemicals that's
Yeah,
being put into, the food that we consume.
yeah.
And also like with industry having like high consumers, they need to find a way of like meeting that
Supply and
demand.
demand. Yeah,
Yes. So, so there has to be that sort of, the demand has to be met.
yeah.
So studies have suggested that. So I think that's also like if stuff is not like organically grown,
Mm,
if you don't like grow, I mean, but also that also comes with technicalities,
yeah.
the way that
Takes time.
we are housed. It's not
Yeah,
everyone who's got that luxury of being able to grow their vegetables,
yeah,
at their backyard, that type
yeah.
of thing.
Land and
But
all
I would,
surplus.
yeah, 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 yeah.
Socioeconomic.
But I would say that studies have suggested
Mm.
to that stuff to that extent does happen. Yeah.
Okay, cool. Ayanda, man, thank you very much for your time. But in closing, final remarks. Anyone who's watching this, who's listening to this, um, what are your final closing remarks that you would like to put out there?
My final closing remarks would be I think for us to address, like from a professional point of view, for us to address the high burden of non-communicable diseases like diabetes, there's work that needs to be done by the government and like industry, like the food industry. I think we can't address that without looking at the contribution of the commercial determinants of health. So my final remarks would be, so we need policymakers to look into that, and we need collaboration between lots of different stakeholders, communities as well. I
Mm,
think communities play an integral part in addressing conditions like diabetes, and they've got a wealth of information. And I think, yeah, for us to address conditions like diabetes, there needs to be like a multiple stakeholder approach.
yeah.